Hello, this is Joe Yuhani here to show you guys my new favorite foam rolling exercise for the rib cage, but it's so much more than just the rib cage. Yes, it's good for the rib cage, it's great for the neck and low back, but this new exercise that I'm going to show you does profound things to unlock shoulder, hip, hamstring, nerve mobility. It does amazing things. And we're going to talk about the why, but we're going to skip to the what. So there's two things that we're going to do. The first thing we're going to do is lateral rib cage rolling, something that I didn't think was possible. And for that reason, we're going to talk precautions. Rolling on the rib cage can be a dangerous thing if you have osteoporosis or osteopenia, if your bones are weak at all, if you have hypermobility as a tissue characteristic. We just don't want a lot of pressure on the ribs, and that's why for the longest time in my career I didn't do this. But if you're healthy and if you're a little bit stiff and if you have a sort of medium density roller, this is safe for you. But as with everything, talk to your doctor. Don't rely on this video alone, but if you feel safe doing it, here's what we're going to do. The first thing we're going to do is roll on the sides of the ribs. So again, I used to think this was really aggressive, and it can be aggressive and painful, but it really does wonders to unlock a lot of stuff in the body. So very simply, medium density roller on the side of your ribs. And because it's so sensitive for most people, we're not going to roll necessarily up and down. You can do that. It's a little bit rough. We're instead going to just pick a few different places to roll. But we're going to roll, instead of up and down, we're going to rotate over it. So I'm going to pick the highest point up in my armpit, and then I can just stay here, modulating the weight with my elbow and my hand here. Simply breathing and letting the body sink into the roller will mobilize the rib cage. And we're going to talk about what exactly is being mobilized in a second. After you've just breathed, you can modulate the direction, the angle of the force by rotating your trunk on the roller. So if I'm rolling up to the ceiling, I'm going to get the back of my ribs directly on the side. And then if I roll forward, I'm going to get and bias the front of the rib cage. I really do like to just hang out here, do a few breaths at a time before I pick a different place. And once you've done that, there's really about 3 levels. Armpit, kind of just above the nipple line, and then just below it. And I'm going to skip to the just below it because this is a really important area. This is the level of the diaphragm. And so the diaphragm has a lot of really important functions in the body. But again, what we're going to do, pin and breathe. We can rotate in or we can rotate out. That is lateral rib cage rolling. Again, more advanced would be to do the actual rolling, but it is not necessary to get the gains from this exercise. So you do both sides, that's lateral rib cage. The next one is very running specific, and that is lower trunk rotation. And so there is a modest amount, but a significant and important amount of thoracic spine rotation that needs to happen when we run or walk or do almost anything athletic. So to work on that, we're going to take the roll this time and we're going to go horizontal. I'm going to show you my side view first. I'm going to take the roll, I'm going to put it about 2/3 of the way down my ribs, or down my spine, near the bottom or the end of my rib cage. Don't want to go into my low back, don't really want to go onto the floating ribs. Positioning the roll here, I'm then, rather than going to arch over, which is its own thing and fine, we're going to stay in neutral, and I'm going to keep my pelvis down. So I'm maintaining neutral, supporting my head in my hands, and then what I'm going to do is I'm going to let my legs fall to one side. I'm keeping my pelvis, or at least part of my pelvis, down on the ground, this right side, and then I'm trying to keep my sternum and my upper thoracic spine on the roller. So I'm not coming off of it like this. I'd fall off. Instead, I'm going to stay here and breathe. This stretches, but it also, using the foam roller, pushes on the vertebrae to facilitate rotation. Same thing. And so, if you have an imbalance, this is a time to lean into that imbalance, spending a little bit of time, or extra repetitions. In this case, I'm stiffer going to the right. So those are the two strategies. And so why I'm so excited about this work isn't just because it's important to have mobile ribs, and that maybe can help breathing, and it can help functional mobility when we run, or it can relieve thoracic pain. It isn't just because a mobile thoracic spine helps the neck, a mobile thoracic spine relieves pressure off the low back. What I'm most excited about is doing this work does profound changes to both upper quarter, upper limb mobility, as in the shoulder, and lower body, pelvis, low back, hamstring, even sciatic nerve mobility in the legs. And how that happens, I don't exactly know why. There are layers to it. And so if we think from most superficial to deep, if we go back to the lateral rolling, and the lateral rolling of the two is the most profound, is the most potent. And so when I'm doing this, what am I doing? Well, superficially you could say, especially when I get a little bit higher up, that I'm rolling and mobilizing the muscle on the side of my rib cage. That is the thoracodorsal fascia, it's the latissimus dorsi muscle. All this musculature needs to move. And the reason it could be an impactful thing for the lower body, even though it's up here, is that the thoracodorsal fascia is this crisscross fascia on our backside that connects upper body to lower body. It connects shoulder blades to pelvis. So conceivably, if I'm rolling on this, that may be why it helps so significantly unlock my low back and pelvis. The next layer down, very simply then, are the ribs. And you could say, well, if we get the ribs and push on those and get them out of the way, rib cage mobilization does help the shoulder. The ribs do need to get out of the way so I can get my shoulder back and down and facilitate overhead rotation. And that may be, but where I think this thoracic mobilization is most impactful is in the internal fascial layers. And within the internal system, within the rib cage, we have several layers. We have the endothoracic fascia, that's on the inside of the rib cage. And then we have 2 layers of fascia over the lungs. And the other myofascial structure that has huge connections to the rest of the body and superbly important for the running body is the diaphragm. And so when we're getting that pressure, especially now if we go to the lower part where the diaphragm, the dome of the diaphragm lives, my theory is mobilizing those deeper layers just by sinking in and softening that fascia, that it is freeing elements, particular in the lower body. I'm seeing clinical changes of improved hip mobility in all directions, sciatic nerve mobility, in how the neurofascial system moves, just profound changes. And I don't think that's just from this external fascia or just from moving the ribs. So give it a try. I encourage everyone to do a pre-test first. And so what are pre-tests? A pre-test would be any sort of mobility test, a thing that you're struggling with. Test that first. That could be something like knee to chest. It could be a runner's lunge, sort of hip extension. It could be hamstring, or if you're struggling with upper body things, it could be neck side to side. It could be shoulder overhead. It could be a toe touch, which is both hamstring and low back. Try those things first, then run through both the lateral rib mobilization and the lower trunk rotation mobilization and see how much that helps you. Good luck.